I want to reflect for a minute on some of the things that have been said and talk about where we are. I think it was Senator Abler who referred to Groundhog Day, and I actually kind of agree. We're having the same conversation. And when I think back a month ago when we were having this conversation, I made an analogy that it's like we're in a big jet plane flying at 30,000 feet. We've got the guy behind the controls, the pilot, and people are saying, hey, he doesn't need to be flying this plane anymore. But we haven't quite exactly figured out who's going to take over and how we're going to keep this plane up in the air. And here we are a month later, we're in the same place. We're complaining about it. We're pointing about how wrong this is. But we don't have any new plans to make this change. So I'm going to go back over again what would happen if this were to happen, and if the legislature would decide to revoke those emergency powers, what that would do to Minnesota, because we've not taken some steps to ensure that our response to this pandemic continues in a way that takes care of Minnesota people, their health, the businesses, and everybody's livelihoods. So, for example, if the peacetime emergency powers lapse, we would jeopardize over $50 million a month in federal funding. And we would immediately roll back important modifications and flexibilities that allow critical services such as nursing homes, mental health services, disability services, and child care centers to operate in the new world of COVID. We've talked a lot about education today. The pandemic has taken a deep toll on school budgets, providing flexibilities for fund transfers that allow districts and schools to remain as whole as possible. And I will interject in this moment as we talk about education. Yes, we all know and believe that our students should be in school, but we have to do it in a way that's safe. And I was a public school parent until just a year ago, and I know that it is on the families and the parents to provide Kleenex and school supplies, and the teachers, they pay for that stuff. We're going to have to do an awful lot of deep cleaning and regular sanitation in these schools, because anybody who's been around an elementary classroom knows that those runny noses are not well controlled. And that's a serious issue because it's not just about, I appreciate Senator Gazelka's point that no one under the age of 20, thank God, has died yet here in Minnesota, but they sure have around the country. And so probably, sadly, tragically, only a matter of time. But children are still able to have the disease and to spread the disease. And that's part of the concern. We need to handle this safely, and that is going to be a significant expense for our schools. Is the federal government going to help with that? I'm not confident that's coming anytime soon, since they're threatening to cut funding. And we know that we're limited in how we can respond because of our need to maintain a balanced budget. So let me continue with the things that will be affected if these peacetime emergency powers were to lapse. Food security for Minnesota's children, which is essential. Schools have been able to provide meals for the most vulnerable at this necessary time. We have ensured care for children of critical workers, from healthcare providers to first responders to grocery workers, so that that's not a barrier for those workers to continue their important roles on the front lines. We have provided leave for state employees who contract COVID-19 or are caring for family members who contract COVID-19. The evictions and garnishment moratoria would end with the peacetime emergency. A current executive order allows the Department of Veteran Affairs to prevent visitors to nursing homes per CDC guidance, and if that peacetime emergency goes away, they would not be able to so prevent. This way, because under current law, there is no ability to basically close the doors if there were to be an emergency and an outbreak and a risk to those veterans. Now they have that option. We have changed, reduced, and postponed various licensing requirements for health-related and first responder boards to help those professionals focus on their jobs. Emergency procurement power allows us to quickly procure PPE, other equipment, facilities, et cetera, without following cumbersome state procurement rules. Without the peacetime emergency, we cannot do procurement and contracting quickly. This is a critical component to our response efforts. Without this ability, we're back to the normal bid process. And I'll point to another example here. Recently, the caucus leaders were invited to join Governor Walz and members of the administrative team to tour this facility that has been identified and set aside for long-term care if we need it, if we need that additional capacity. And it's an amazing story because this is a Presbyterian Homes facility that was slated. They literally had the bulldozer in the parking lot. It was slated to be torn down because they built a new one, but they still had this building in place. And they were watching the news and they said, hey, wait a minute. This facility may actually be really helpful. So they contacted the Department of Health, and we have incredibly cost-effectively been able to make basic modifications to that existing structure so that it is ready to go in a 72-hour period if it's needed. And that has been done because these bidding and procurement processes were streamlined, and they were able to manage the waivers because we know healthcare can be so convoluted. This is the state, this is the county. And the other thing that's interesting is that they've identified similar types of facilities around the state so that if we have outbreaks in different parts of Minnesota where they need additional care capacity, we are in a position, we have the model, and much more cost effectively. I think they said that a similar type facility in Wisconsin cost $7 million to provide, and we were able to do this, I believe, for under $2 million. This is what we've been able to do remarkably efficiently because of the governor's powers to coordinate all these efforts among the agencies. And also, finally, the declaration allows for the more effective operation of the Strategic Emergency Operations Center, and it makes a stronger case to FEMA for reimbursement and makes for a cleaner process in how we work with them and avoids confusion. I know this is not anybody's ideal way of doing things. I don't think there's anything about a pandemic that people think is ideal. Wearing masks, not ideal. Staying home, not being able to hug my loved ones, not ideal. But this is where we are. And there's common sense things that we can do to help keep Minnesotans healthy and safe. We know we can't be perfect. We can't live in full lockdown. We have made a lot of adjustments so that we can try to live as effectively as we can and striking that balance with being healthy and being safe. And I appreciate Governor Walz's leadership, his thoughtfulness, his care. He takes criticisms from both sides of the aisle. He gets criticized for opening up too much, and he gets criticized for not opening up enough, and most of us in this business think that's probably when you're kind of in the right space. So members, this is an important time. This is not a typical emergency for which our laws were originally envisioned, but it is an emergency nonetheless. And I strongly encourage members a red vote on this resolution.